It is 3:09. Apologize for a little late, but I am going to call the Commission on Aging meeting to order for April 17th, 2024. First item on the agenda. First, we established that we do have a quorum. Excellent. Thank you. First item is approval of the agenda.
I move to approve the agenda. This is Erin.
I'll speak, so go ahead. I'll second that. Go see it one more time. I'll second the agenda. Approval.
All right, thank you.
And Madam Chair, Madam Vice Chair, for the minutes, that was Commissioner Smith.
Okay. And we have a motion for approval of the agenda in a second. So for easier for people online, anyone opposed, raise your hand. All right, seeing no opposed, the agenda is approved. We have consent items, and the only item for consent is approval of the minutes from our last meeting, March 2024. If there are any items that need to be modified on the agenda, please let us know, or we'll entertain a motion to approve the minutes from our last meeting.
I'll motion to approve.
And for the minutes, that was Commissioner Cirillo Smith. Please be sure to announce yourself when you vote or provide a second. That will help us for our recordings and our motions. Thank you.
All right, do I have a second?
This is Erin again, and I would move to second the approval of the minutes.
Thank you, Erin, and Amy Smith also approved, provided a second. So anyone in the room or online opposed to approving the minutes from last? All right, seeing none. Our consent item is complete and we have approved our minutes. Next is any public comments. Jared, did we have anyone sign up or interested?
So, Madam Chair, I will just say that for anyone who's online who's not already a commissioner member, which I don't think is anyone, they can use the raise hand function. While they're looking for that option, I will just let the commission know that we did not receive any advance requests for public comment. We did not receive any written public comments that we would have distributed to the commission members ahead of time. Again, I don't think anyone online is not already a commission member, so I think we can move forward from public comment.
Thank you very much, Jared. Appreciate you. And our esteemed chair has just entered the room. So Paula is here. We'll let her catch her breath and get situated. And at this point, any action items?
Madam Vice Chair, there are no action items today.
Okay. Thank you, Jody. Would you like the handoff, Paula?
Hi, thank you for your grace on my being late. It's one of those days. So we're on item number 4, public comp.
Item number 6.
Oh, item number 6. I was going backwards, sorry. Item number 6, information items. Do we have a membership committee report?
So this is Melissa, and Erin, I don't know if you want to comment or if I should go ahead and comment.
I was going to say I would defer to Melissa for an update.
Well, thank you. And so we have reached out to the city of Woodland Park. And at the time that we reached out, they were undergoing their mayoral election. And Mayor Kelly Case was elected as mayor of Woodland Park. And she did say that she was interested in meeting with Erin and I to talk about an appointment process up there with the city of Woodland Park. And the two women from UC Health up there, Shannon and the other gal, are both still interested. Shannon was going to attend the meeting today, but I don't see her on yet. She may still join, or she may have had something come up. So we are moving forward with that process with the city of Woodland Park, which is good. And Green Mountain Falls is the next group for us to circle back with. And I think that is my update, unless Erin, I forgot something else.
Nope, I think those are all the moving parts right now. Thank you so much, Melissa.
Okay.
I have a commission email that I can't access right now, but I received a email stating that Mary Duran, due to work constraints, she just cannot give what she would like to give to the commission, and she would like to tender her resignation effective today's meeting.
Thank you. I got that written down in our
Okay.
minutes.
Erin, I did meet with someone today over lunch who is interested in serving on the commission. She is more senior than most of us and has a great nursing background, and I think would be a great addition. So I will hand off her contact information to you, and she is very interested in joining the group. So
That
Yep.
sounds great. Thank you.
you're welcome. Policy Committee is next. And Jared's making his way to the mic.
Good afternoon, Commissioners. Jared Verner with PPACG and the PPAAA. We are, 21 days to the end of the session. And it is going to fly by, I have a feeling. So some updates on legislative activity. The Long Bill of House Bill 1430. That did include an extra $2 million for state funding for senior services. We were hopeful for more. There were amendments on both the House and Senate floor that had about $6.1 million that would have gone to the fund, which would have been phenomenal. We're not going to complain about two, but two is not six. So, but we're incredibly grateful. Jody did a fantastic amount of work, along with the other AAA directors across the state to really advocate, because the flip side, if they had not given any more money, we would have gone back to about pre-pandemic levels, which obviously would not have factored in the growth of the population, and it would not have factored in inflationary costs. And so we still got Senate Bill 40, which is in the works. I don't believe it's been scheduled yet. It's still in the Senate appropriations process. That had a $5 million appropriation, which obviously that part's not going to be part of the discussion. But there were two other pieces of that bill, which would require that fund to go up as inflation goes up, and it would require every 3 years an evaluation of what the appropriate appropriation would be. So we're very excited that those two things, and that hopefully gives us a little bit of future to plan for when it comes to the state fund for senior services, so that we're not in this position again in the future. Some other bills that we're tracking within the aging area, bills that PPACG is supporting. There's House Bill 1312. I'm sorry, we're in an amendment position now. That is state income tax credit for caregivers. The original draft had it as where it looked like unpaid caregivers and those providing care for those 16 older would have qualified for the state income tax credit. In committee, that was adjusted to only those who are paid and only those who are basically giving care to children. So PPACG moved from a support position to an amend position to try to get unpaid caregivers caring for family members back into that bill. And so we're hopeful for that. That went through House Finance, and it is currently in House Appropriations, along with multiple bills that we're tracking. Those are the big ones. There's a couple other bills that PPACG is monitoring, which do have some impact for senior services. But I'm happy to answer any questions unless Jody has anything else I forgot to add.
No, thank you. I do want to recognize also members of this committee as well as staff, members of our Regional Advisory Council, and many of our contractor providers who also engaged in the advocacy work to recognize the need for the increase in the funding for senior services. And that is the specific, you'll hear us talk about the Older Coloradans Act, the Older Americans Act. Older Coloradans Act is the act which enabled the functions as well as the funding. When we think about the specific budget line item, we talk about the state fund for senior services. So those are used somewhat interchangeably, but at the end of the day, it's all pointed to the funding for the services that we provide as an area agency on aging across the, across our 3-county region as well as other AAAs across the state. That $2 million appropriation to add to Jared's comment, yeah, it's not 6. It will likely be distributed by the interstate funding formula, the IFF, and that is a formula that's determined at the national level, using everything from population and portions of population across our 3-county service region. And so right now it's about 11%, but we don't know what the state's portion will be out of that 2 million. And we have just learned not to get excited until we actually have a contract in hand with our portion allocated. So, but it is important for us to realize that while it's not what we were asking for, the process worked. There were so many people engaged in the process, calling their legislators, calling the JBC members, emailing, and I just really appreciate the back and forth. I would hear from those who had sent out letters, who received responses, showing those responses, and it was just really exciting to see the engagement across the entire process. So while the legislative process is just a few months at the beginning of the year, know that we're going to be having discussions across the state as to how best to pick this up and get started again for next legislative season. So thanks again to everyone who's engaged in this. We do still have the other 2 parts of Senate Bill 40 to sort out and make recommendations for. So if you've been part of my army of advocates, be watching for more information on how you can help again here very, very soon. So thank you again, Jared, for tracking all this for us and being part of our process.
Thank you.
Thank you, Jared. Next is item B, Policy Committee, Colorado Center for Aging, formerly this Colorado Senior Lobby, and Commissioner Mitchell will give us a report.
Thank you, Madam Chair. I was only on the meeting for about 1 hour out of 2, got pulled away. A lot of the bills that they were talking about are not really pertinent to what we do on the Commission on Aging. They talked about, of course, the long bill of 1430 and where we fell short, but we consider it a win because any positive increase in funding is positive increase. And just build on the foundation from this year, and we will be back at it again. I did hear from quite a few on the committees that were hearing this and the Budget Finance Committee, and they all voted in favor, but they were not quite passionate enough to push for the complete 6 million. So I know who to ping, start working on for next year, who at least are willing to have communication. Just to give you a rundown on what the Center for Aging, Colorado Center for Aging is looking at is they're looking at some protections on real property, 1230, and sunset processes for deaf of hearing and finance support, 1276. They're also looking at HB 1438 with regard to implement prescription drug affordability programs, and HB 1005 health insurers contract with qualified providers. and two more, SB 24-111, senior primary residence property tax reduction, and HB 24-1233, homeowners association delinquency payments enforcement procedures. And these were all either amend, oppose, or support that were on the list to get in front of the legislature this week with the Center for Aging. So they're very engaged, not quite our bailiwick, but they are working specifically on issues that affect older Coloradans, and they are doing really good work. So if anyone would like a link, I will send this to Melissa on the list of bills and hot links for what they discussed this Monday. And anyone can dive into any of those further if they're of interest. So thank you, Madam Chair.
Thank you, Commissioner Mitchell. Next, we have the PPACG Legislative Committee report. And is Commissioner Cirillo Smith on?
Well, actually,
It's the PPACG report is what Jared just provided.
Oh.
So. Yeah.
I'm sorry.
Yep.
Then we're, oh, I'm sorry. Okay, so we are on the State Commission on Aging report.
yep, and Kathy is in the room.
I didn't know Kathy. Thank you. I was wondering who that was. Welcome, Kathy. Thank you for being here.
Thank you. So you have me at a little bit of a disadvantage because our meeting is tomorrow, but I do know that there's one thing that I thought would be of interest, and that's they're giving money to people who want to build housing for seniors, and you can come in as an agency. It's not limited to, I don't remember how much it is, like 200,000.
And
All this
There you go.
technology.
Yeah, you can just leave it. You can-
Okay, oh, it'll stay on? Okay, good. So, so that's one thing that I thought would be interesting. If you partnered with, well, anywhere, it's money that could be used to provide more affordable housing for older adults and have it be accessible. And that's kind of what the Housing Committee on the state is doing. They're trying to make age-friendly, affordable, accessible housing. And it's kind of called AAA. But they're really working on doing that, and the governor wants us to come up with, well, not us specifically, but he's trying to come up with transit orient, and they're looking at doing a transit from Pueblo to Longmont to link places better. And then he wants senior communities kind of located along that path so that they are within walking distance and they don't have to drive anymore. So, or local buses. So, I mean, that's really one of his big focus. So it's kind of interesting to see where we overlap with the governor and where we don't overlap with the governor. So, but we usually do. So, and we're only allowed to support bills that are already supported. It's because, I mean, we go through the list and then the human services person tells us, you can't really take a stance on that one yet. So it's all new to me. So it's like, it's a real learning process. But it's interesting.
Well, thank you for doing what you do.
Oh, and then the conference. It's June 6th at the Embassy Suites in Loveland. It's from 8 to 4. And there's been some chatter about everybody meeting the night before, but I haven't heard anything solid on that.
And just to add a little bit more detail, this conference, I think, has not happened in 2 years, maybe. And so it's exciting that it's happening again. I know Jody and I are going to go up to that conference. So we'll be in attendance up there. But if anybody else on the Commission on Aging from Colorado Springs is interested in thinking about going, let us know so that we'll know people are going. And Kathy, are you going to be going for sure?
I don't have any transportation to get there.
Interesting.
Metro Mobility doesn't go past
Yeah.
I don't know, doesn't even go as far as the Air Force Academy.
Uh-huh.
So, you know, kind of a little bit limited. And indeed it doesn't either.
Right.
And that's the other thing, is Silver Key's having theirs summit at Great Wolf Lodge. Metro doesn't go there. Silver Key doesn't normally go there. So they're gonna try to dedicate 2 buses just to be shuttling back and forth. So that's, I thought, what you guys think about that before we scheduled it?
But now they get to figure out how to solve the problem.
Yeah, that's true.
Wow.
It is for me, 'cause my husband and I are both volunteering at it. We're both in wheelchairs. So we're either gonna have to wait for the bus to shuttle around or bring the other one of us. It's interesting. Another thing.
We did receive the most recent, the last updated flyer for the June 6th conference. So we'll make sure that goes out to all of our network, including the Commission on Aging. So you have that. There is a link for the hotel if you want to go up the night before. And so they do have a room block at a little bit lower rate available for that. So we'll share that out. So, but it's just a 1 day. So
I plan to go.
Melissa, I'm sorry. I just had one. One thing they're gonna do is they called it cafe sessions for their training sessions, and they're trying to. They have some speakers, but they don't have them all confirmed yet. So they said they were gonna follow that format. So.
Great. Thank you, Amy. Nice to see you in person. Put a voice with a face. I whispered to Amy, who is that over there? She's like, I don't know. Now we know. Thank you for being here. Next is chair report. Oh, I'm just going back and forth. I'm sorry. And that's you, right?
yes.
All right. Next
no
is
worries.
Jody. Board items report.
Yeah, so this is where we might normally add some information around the legislative work that's been done by the PPACG legislative subcommittee. But 2 things I thought I would share this time is that we'd love to have you at the May PPACG Board of Directors meeting, May 8th, here in this room, beginning at 9 a.m. They will be doing a proclamation to recognize Older Americans Month, which is May. And so just wanted to share that. We'd love to have you in the room as part of the support for that. And then the next Thursday is our Regional Advisory Council meeting. And that will be the big part. There's actually really 2 big parts. We'll go through our regular business meeting quite swiftly, but we will be requesting a contingent vote on the funding for those providers who have applied for funding. We have not received our federal or state allocations. As you heard today, the $2 million was just approved as part of the long bill, but that still has to go through its life as part of the bill. And so the bill process rather. And so we don't really know when that allocation will actually be made. And we do know that the State Unit on Aging, our state administrators have not received the federal allocations either. So we have to keep moving though, so that we can come to contract time on time. And so a few years ago, we decided there's a lot of work we can be doing behind the scenes while we wait on the final contract. And so what we do is we go through a contingency vote process. So we will take this to the Regional Advisory Council next Thursday at 10 a.m. For that contingency vote. Based on availability of funding when we receive the actual allocation. We will do the same thing in turn at the May 8th Board of Directors meeting. We will request a contingent vote. And that will allow us as staff to continue moving forward, plug in the final numbers when we receive the allocation. But a lot of the behind the scenes work just takes so much time to come to a contract that it's just crucial for us to be able to continue moving forward where we can. So be aware of those. But the other part of next Thursday's Regional Advisory Council meeting is our annual provider fair. And so we would invite anyone here who's in the room or online for the meeting today to join us, because all of our current contracted providers will be here in the room. The room will be completely transformed from a board meeting room to a senior fair. And so all of our providers will be here with their information, their staff. You can learn more about their services, collect their information, ask questions, take information back to your communities or your businesses, and share that information. But we're really excited to host that each year. Of course, we had to pause that a couple of times during COVID, and we heard back from our providers, when are you going to do that again? So it's an exciting time for us. It'll still be during the same 10 to 12 Regional Advisory Council meeting time. Like I said, we'll zip through our business meeting and get right to the provider fair. So if you're available and you would like to come and visit some of our providers in person, they will be coming from all across the region to spend the morning with us. We'll have some refreshments here in the room and just a great time to visit with each other and learn more about what these providers do for the seniors across our region. So just wanted to share that, and look forward to seeing you next week, and possibly the May 8th meeting, 9 a.m. It will be early on in the meeting if you don't want to stick around for the whole thing, but it will be that proclamation for Older Americans Month. So thank you.
Great. Thank you, Jody. Sorry for skipping over. Next is the chair report. And I don't have a lot to report, but I noticed that Kent Matthews is in the room, and I don't know if he would be so kind to come up to the mic and tell us about how Savvy Caregiver Pampering Day went. Please, and thank you.
So on this past Saturday, April 6th, we had the 21st annual Caregiver Pampering Day. I've been in charge of organizing it for the last 17 years. This year we held it at the Westside Community Center because the senior center is, I don't know if they physically started to tear it down or not, but it's been closed. So we had to go to the Westside Community Center. We had about 30 caregivers registered, and we provided them with pampering activities. The caregivers reported that the day helped them to feel appreciated as caregivers. It also, they also, from the survey that we always give at the end of the pampering day, said that they learned about some new resources available to help them with the caregiving. They also just appreciated being pampered. Verbal feedback from the caregivers was that they really enjoyed being in a space with other caregivers where they didn't have to explain anything. And so that presence of being together with other caregivers was the best amount of support that the caregivers received. We had 35, 40 volunteers that help make the day work. And of that 34, 35, 10 of them there were 4 adults and 8 scouts from Boy Scout Troop Number 2 that helped us. It was the first year we've had the scouts involved as volunteers helping, and they really loved it. The feedback from the adults was that the scouts who were there were working on a community. There's a merit badge that encourages the scouts to get involved with community organizations. And so those scouts were working on that merit badge. And so for further pampering events, we plan to continue to involve the scouts, especially those that are working on that kind of a merit badge, because they have to have 8 hours of involvement with community organizations. That's part of the requirements that have to be met for the merit badge. So learned something new, and that was really fun. And we will start planning for the next Pampering Day starting in September. It takes us about 9 months to plan it. So we'll start that in September. So we plan to have the 22nd annual Caregiver Pampering Day. So thank you.
Thank you, Kent, for sharing that. And I know that Voices of Grief also had a caregiver weekend that coincided with the same Saturday as Kent's, and I was attended and was part of that Sunday session, and it was interesting. It was a different kind of caregiver workshop, and that Saturday session was for professional caregivers, and Sunday's session was much shorter and was for the actual personal hands-on caregiver at home, and was much different than what the Pampering Day folks got in the way of resources and education. It was very much finding themselves and where they are. And the leader, who is a caregiver expert, is also a choreographer. So it was a lot of movement with yourself and then side by side with each other. It was very interesting, but it was not what some people thought they were signing up for. And so it was interesting, very interesting. Anyway, I thought I'd just comment. I don't really have anything else to comment on chair reports unless Melissa's going to tell me I do.
I'm just curious with the Voices of Grief, where did it happen?
That took place at Pikes Peak Hospice in their offices, administrative offices, which is at the top of Tenderfoot Hill. Great space, really nice space for that type of and that size of event. We too were going to have people bring their loved ones if that was the only way that they could attend. And people did sign up to do that, but nobody actually did bring their person. So it was, yeah, they provided lunch on Saturday. The Saturday session was all day. It was 9 to 4. It was an all day session. And I thought there'd be more, I guess, because I'm such in the dementia world. I'm in just that dementia lane most of all of my days and nights. I thought there would be more dementia professional caregivers there, and there were not. There were counselors and some nurses and just different people that I just was looking for my dementia people, because I thought those folks especially need support, and they're most often overlooked in needing support to do what they do day in and day out. So I was looking more for that type of professional caregiver, which we will try to address during our up and coming caregiver conference that we're going to be working on in our work session. So that's all I have for chair report right now. Thanks. Next, do we have any presentations?
No presentations this time.
Okay. And now number 8 is working sessions, and we had planned to go into work groups to talk about our goals and for people to get with their small group. I don't know who's.
I can share an update on
Yes.
what we're going to kind of do here in the next
That would be great.
little bit of time. So thank you to all the folks that are in the room as well as virtually. And Jared and I have worked really hard. I think I've worked much harder than Jared. Kidding. Sorry.
That wouldn't be hard to do.
Okay. Anyway, we have the opportunity to put people into some specific spaces and be on the computer to bring people in. And so I'm going to walk through some logistics here for a bit. But before I do that, I'm wondering, do we want to spend 20 minutes in breakout? Do we want to spend 15, 30? It would be important to come back to the room and do a debrief. And so if we did like a 20-minute breakout in about 5 minutes, that would bring people back at 10 after. And so maybe we would, it's going to take a little bit for people to go and get settled in. So maybe we could have people come back at about 4:20 And then we would have time to do a debrief.
Mhm. And what if that seems to be too long for the
Yeah.
group? I'd rather do it short and
Okay.
then have you check someone check in to see if we need more
Yeah.
time, then
Okay.
have more time and then us just
Okay.
kind of twiddling our thumbs. So um, I'm thinking 15 minutes.
Okay.
And then if we'd like more time, then we would say more time because I don't want this to go on and us looking at each other on screen and going, oh, what, because it's the first one and I think people haven't, I just think maybe that's my 2 cents.
Okay. So then when we break out here, we'll have people plan on coming back at about 5 after.
Okay.
So, and so the way that we have things set up is the caregiver group can stay here in this room. And we're going to have Dayton and Aaron actually do their own kind of breakout room. They're the only, and I may join them, but I may not. Jared, we'll see kind of how that goes. Because technically a lot of the work I've done has had to do with housing. So I was going to try to sit in with Dayton and Aaron, and I might do that. And then we have the Access to Healthcare group, which is Amy Mitchell and really Penny. Steve is not here. And so you guys will be able to, Penny's going to be online, but Jared will be able to, Amy, you can go into, no, Amy, I'm going to take you upstairs to a room upstairs. And then we'll get you online there with Penny upstairs. So I'm going to take you upstairs. And then social engagement with Kathy, since Mary has now stepped off the group. What we might do, Kathy, is just potentially, if you wanted to sit in on the caregiver group that's going to be here and just kind of listen in to that group. And I think that because of your life circumstances, you would also have a lot to share. You and your husband have talked a lot about caregiving and what that looks like. So it might be okay for you to sit in on that group until we get a few more. We did have a staff person from the Area Agency on Aging who is interested in the social engagement group, but I don't see her in the room right now. So
And Kent plans to sit in on our.
join you guys.
Yep.
Yep.
Mhm.
Yep. So if that's all right, here we'll kind of take a little pause. Caregivers stay here. I'm going to take Amy upstairs to connect with Penny. And Jared, go ahead.
I think Connie's going to ask the same question I am. Or maybe I can just ask Connie directly. Of those 4 groups, which group would you like to be in, Connie?
Connie's in the caregiver
She's in the
group.
caregiver group, so
Okay.
don't try to view her somewhere else.
So she'll just stay right here.
She's gonna stay right here.
I just wanted to double check.
Okay.
Assigning people.
No,
Okay.
I got a hook on her. She's with me.
Does that work, Jared? Okay. All
Thank
right.
you.
And Melissa,
Mm-hmm.
I can just go find a corner and I can even call Penny on the phone.
Well, I thought about that. Do
you know,
wanna do
because
that?
We know each other. I
Yep.
mean, we work together kind of.
Yep.
And so I don't need a big space.
Okay.
I'll
put you
For just you.
over here. So I'll take you to this
That'll be
room and
great.
You can dial her up on the phone. Okay.
All right, great. Come on over, Kent.
I was gonna say, if you want to have the staff person call me, it'd be fine.
I think I will.
So are Aaron and Dayton meeting?
Everybody's got our bus schedule.
So Jared has created a breakout room.
Okay, for them. Okay, great. Kent's gonna come up here and we can start.
Okay, so for those who are online, or go ahead and go to your breakout rooms momentarily.
And report back at 4:05. Thank you. I mean, let's recap. Does anybody want to recap? Amy, how did your talk with Penny go?
Talk with Penny went great. We actually touched base a bit yesterday also, since she is my director, of our senior coalition. And, did have a chance to talk to, our South Park Ambulance District, since our last meeting. They have 3 ambulance, buildings, one in Jefferson Como, one in Fairplay, and one in Hartselle. And they've got exam rooms in each of those, in each of those buildings. And in the conversation, the challenge was having the building accessible if they are on a call. So if they've run a call, the building is locked. So Penny and I put our heads together to see, she's got multiple volunteers who are bored and would like to provide more assistance. So our plan is to ping all of our seniors in Park County to find out um, if um, if they would be, if it would help them to be able to use an ambulance district that's probably within, I don't know, 15 miles of their residence as a location for telehealth. If there was somebody there to help them dial in, if they could use it for a monthly prescription doctor visit or their 90-day prescription under Medicare visit. So we're going to ping them and ask them some questions to find out if this would be value to them. We could also use the voucher program to give them rides to the ambulance district, which is much, much closer than going to Buena Vista or Summit County or Woodland Park or whatever they have to go for their doctor. And find out if it would be beneficial and then how often they would need it for either prescription refill or for their desired checkups with their doctor. And so we're going to do that survey of just Park County seniors. And our thought process is we're going to touch with Platte Canyon also. So we'll have 4 locations and do each location twice a month. So maybe Hartselle, first and third location, maybe some of the others, the second and fourth week. So every other week, they could know this certain day could be carved out for them to schedule a time to go there for their telehealth visit. Because as we've discussed, more frequent touches with their doctor helps keep their medical situation much better than waiting too long. And so, Penny, if you would like to provide any other context, we're going to see if we can get agreement with everyone, get some input, and then I'll kind of put up a plan that we're going to do in Park County and see if then it could be duplicated down the hill in Teller and El Paso.
Correct, yes. And I believe that that's going to really be a real plus for the seniors. But we'll know more after we have 3 questions that we're going to ask them about and ping them and then get a response. And I'm very, very curious to see how they will react to it.
Thank you, Penny. You're awesome.
Okay.
You do a good job.
Thank you.
I think that's great. It sounds awesome. Very, very good. You guys are rocking and rolling.
Does Erin
Date-
have a question?
No, she's just can't put her hand down unless she might have a question. It's a curious thing. I don't think she does. I think she'd speak up if she had a question.
Okay.
Dayton, do you have anything to offer? I know you were in a room by yourself.
I don't, unfortunately.
All right. No problem. Okay, so for the caregiver group, we had Kent Matthews join us and Kathy joined us also. And Connie was online. Connie, do you want to report out for us? Because I talk way too much.
Sure. We basically are open to adjusting our timeline for things. The focus is education and resources and creating multiple different tracks for our caregivers and maybe including some pampering. But the goal here is to not create just another conference, expo with trick-or-treating and booths and that sort of thing there. And then I think one thing that would be really cool is to develop that template so that we can duplicate it in each county, because that was something we had talked about. And then starting small and capping the attendance. So we just, as far as next steps go, we need to get together and have an official meeting so we get this kicked off the ground and start recruiting people to help with this whole big idea.
That's great. Yeah. Does anybody know how to do those Google Calendar poll things, like you put out a few dates and let people? I don't know.
I do the doodle polls. That's what I'm familiar with.
Could you
And
help
I'm
me with
happy to help you guys
that?
with
Would be
that when you
awesome.
need
We'll do that for some dates.
Yeah.
And we'll go from there. We'll try to get that out by Friday.
Okay.
That would be awesome.
And who are the people that need to be on that?
Amy and not that Amy and Kathy.
Just Amy?
Yeah. And
And then,
Kathy and Kent and me
And me.
and Connie.
Okay.
And maybe Erin, since she sat in on it. I hope she got her hand down. Nope, I think she's out. Anyway, anyone who would like to join us and then please, once we set the meeting day and time, if you feel like you know someone who would want to be a part of it and you'd like to invite them, feel free to invite them. I'd rather have them in on it from the beginning than join us midway through. So if you know people that you know would be want to be a part of it and not come in and out, float in and out, then please, once we get the meeting day and time set, please include them. And I plan for them to be hybrid. All right. I think that's all we have as far as working session recap. Next is number 9, discussion items. Do we have any items that are up for discussion? Hearing none, we'll move to item number 10, member entity announcements. Does any member have any announcements they'd like to share with the group? And it doesn't have to be commission related. Does anybody have a celebration or something happy that's happening with their life? I do. I have a son that's graduating from CU Boulder on May 9th. Yes, very exciting. Huge, huge, huge step, huge feat. So that's what I'm celebrating. Connie, do you have any celebration?
I have a 2-month-old son now who he's upstairs crying at the moment. And oh.
Oh, that's great. Does anybody else have a celebration they want to share? Dayton, you got one?
Yeah, I was just gonna mention another invite. Most of us have most likely received an email from Innovations in Aging with an invite to the city council resolution going on the 23rd next week. So certainly I think that email, if you don't already have it, we'll make sure everyone in this group gets it so that they kind of know the times. We haven't yet got the agenda and we know how long those meetings are and no one wants to sit in on those whole things. So we're kind of keeping our ear to the ground for that. But what it is city council is going to recognize Innovations in Aging to just kind of all the age-friendly work. We're going to use that as an official platform of us, quote unquote, handing the age-friendly work over to the city, as well as recognizing Innovations and all of the work that it has done over the years for this community. And yeah, seeing that the organization will be sunsetting here mid-year. We're going to use that as a good celebration for people to connect and people and folks to be recognized who have dedicated their energies toward a lot of the great stuff that's unfolded from Innovations and the age-friendly work. So big invitation to everyone for April 23rd, which is next Tuesday.
Yeah, great. And what time does that council meeting usually begin?
I'm not sure,
Is
but
it-
we could send a
Okay, that's fine.
to everyone.
Yeah, that would be awesome if as many of us could get there as possible. That would be great.
So Madam Chair, I can just interject. So the council meetings will start at 10. Proclamations and resolutions of this matter are usually on the front end of the agenda. So I can't, but to Dayton's point, are we number 1? Are we number 6?
That's
You know, will we be at 10 or will we be at 11:30?
okay.
So just keep in mind, but we should be hopefully before lunch.
Okay, great. Then maybe we could all go out to lunch and celebrate somewhere. That would be fun. Okay. Thank you, Dayton, for that.
I know Jody was hoping to attend,
Okay.
and I cannot attend
Okay.
because I have a mobility coordinating committee meeting here. So again, if other people are able to sneak down to Colorado Springs, that'd be great.
Yep, that'd be awesome. Thanks for that, Dayton. Amy Mitchell has an announcement.
Just to let everyone know, in Bailey, the northeast part of the Park County, they are doing an effort to put together a health services district. The district would mimic the school district on the northeast side of the county, and it's about where 60% of our population lives. And the nearest healthcare is Conifer, which in our world in Park County is only about anywhere 13 to 20 miles away from folks that live there. But they are going to put a service plan in front of the Board of County Commissioners and present, and then those Board of County Commissioners will decide if we're going to put it on the ballot for the people in that proposed district to vote on to move that process forward with a 1% sales tax. So that's some work on that part of the county to try to help improve access to health care.
Awesome. Great. Thanks for that update. All right. We don't have any more member entity announcements. Anybody online have announcements that I'm missing? No. Celebrations? No. All right. Item number 11 is meeting schedule. Our next meeting is scheduled for May 15th, 3 to 5. I will not be at that meeting. So Amy will be running the meeting in May. The executive committee meetings are open to all, and they are usually all Zoom. Everyone usually Zooms in, but you're welcome to show up in person. They're the first Wednesday of each month at 8 a.m. If you show up in person, it's right here. And the policy committee meetings to be announced, and the PPACG meetings are listed somewhere. Oh, the second Wednesday, the PPACG board meeting? Yeah, is the second Wednesday. Oh, there they are. There they go. Thank you, Jared. Perfect. And I think we get an email with all those meetings on it. Yep. All right. Items for next meeting. I think we don't have any. I think we'll continue to do the breakout sessions. If you meet, tell me the protocol if we have meetings off site. What do we need to do, or do we have to meet here, or do we have to videotape it? And what's the protocol so we don't get in trouble for having working groups?
So if it's 3 or more, that's your magic number. And if you are going to meet off-site versus at our lovely facility, I just need 24 hours notice on time, date, and place.
Okay, so 3 or more, we'll have to let you know.
Mm-hmm.
If it's high, if we want to have it here, depending on the time and day, we could have it here and use the hybrid stuff.
Yep.
All right.
That wouldn't be a problem. We just need to make sure we have
Space
one of
available.
the conference rooms available.
Okay. All right. All right. So, okay. Perfect. Thank you, Jared.
Yep.
All right. What else for next meeting? Can't believe it's already almost halfway through the year. Well, if we don't have anything else for next meeting, happy Mother's Day to the mothers on May 12th, on May 12th. And I don't know what else. Anybody? I think that's it. All right. Thank you, everyone. Have a great rest of your week and see you next time.